Okay, so thanks. So I'll go through fairly quickly, but obviously happy to go back or address any questions or feedback input people have at the end of it. And just thought I'd use this opportunity to highlight some of the key pieces because it's a long report that may be relevant. So first of all, the CMOH, Dr. Moore and the team informing highlight that substance use is significant in the deaths it causes. Nearly 25,000 deaths from substance use per year in Ontario, and the cost burden of substance use as well. You can see it's also important to note hospitalizations and emergency department visits from substance use are significant, and this constitutes obviously a significant burden on the challenged healthcare system now too. I think very interesting to reflect that in particular, alcohol has a significant burden of death, but especially of hospitalization and ED visits, and as a result, results in societal and healthcare system costs in excess of $7 billion per year. So probably the most costly impact of the substances. The other thing that I'll just highlight, in particular for cannabis, the deaths, certainly the number quite low comparatively. And those are predominantly driven, as I understand, from motor vehicle collisions, where cannabis is a contributor. So you can see, substance use has a significant public health toll in Ontario. This data, it's important to just note, is from 2020, so probably changed and accelerated, especially as we know that opioid morbidity and mortality in particular has accelerated. When we zoom in locally, we unfortunately don't have data on the burden, both for hospitalizations and the cost burden of cannabis locally. We do have data on tobacco, alcohol, and opioids. So the data that you're seeing here, tobacco and alcohol, is drawn from Public Health Ontario, produces a modeling report on the burden of tobacco and alcohol. And the opioids data is just drawn from our dashboard, which is called the Early Warning and Surveillance System, which is available on our website. So in the context of tobacco, every year, approximately 1,100 people hospitalized, and over 250, about 267 estimated deaths from tobacco per year. Alcohol, 61 deaths, over 300 hospitalizations. And opioids, we unfortunately don't have direct hospitalization data, but the ED visit data is included there. And the death data is significant, 71. So, I mean, just to highlight comparatively, we know from previous presentations that have been given here at the Board of Health, our opioid harms and deaths are nearly double the provincial average. And you see that reflected proportionately when you see locally the high burden from opioids here. Measuring substance use harm, so back to CMOH report content, that's the only piece on local data. Measuring substance use harms, they talk about then $18 billion in harms. They reflect that is 5 times more than revenue that's generated from alcohol sales. The burden of alcohol costs 5 times more than the revenue generated from that. And it's about 4.5 times, the costs are about 4.5 times more than what is spent on public health and population programs overall. So significant. I think the report was really helpful to highlight pandemic trends, so some disturbing trends in increasing harms. People who had not previously smoked tobacco began using vaping products containing nicotine at a much higher rate. We're particularly concerned about younger adults in this context. More cannabis use and more cannabis-related emergency department visits, and you'll have heard lots about cannabis from the presentation that Dr. Tom Bell gave to the Board of Health last year. Increased toxicity from alcohol, more polysubstance, which means more than one substance use, which increases the risk compared to substance use individually, and growing number of youth with co-use of cannabis and alcohol as well. So some important trends that changed through the pandemic that were identified in the report. I think one of the most important parts of the report is really differentiating. There's lots of downstream factors. They talk about availability of the substance, how addictive it is, the environment around it, how easy it is to access. But that if you dig deeper under the surface are some of these upstream factors which societally are the determinants of health, structural determinants of health. They talk about belonging, services, and support, and so the upstream factors, probably very important to actually then addressing substance use, which we see the downstream consequences of. There's some important content in the report around Indigenous peoples specifically, and a recognition that, of the long-term, long-standing impact of colonization, residential schools, ongoing anti-Indigenous racism, intergenerational trauma that contributes to experiences of substance use. And I think some helpful engagement and work, including with and informed by Indigenous partners for the report on decolonizing practices and interventions that really need to be thoughtfully designed by and for Indigenous peoples directly. So they talk about the protective benefits of space, of language, of culture, and self-determination is really critical to addressing specifically for Indigenous peoples substance use related harms. In all, the report talks about needing to take an all-of-society approach to improving health and reducing substance use harms. You know, this isn't just a public health issue, these are societal issues, and as such, you know, can't just be solved by the, by public health units or by the Ministry of Health. Getting into some of the specific recommendations that are referenced, and it's probably too small to see on the slide here, but hopefully you have either on your computer or in the package. They go through tobacco, vaping, alcohol, cannabis, and opioids separately with recommendations. So I'll go through and I just want to highlight a few. On tobacco, we know that there's been decades-long work on tobacco, and that work has really resulted in progress. We reported in Holly's presentation later last year about decreased lung cancer deaths from decades-long work of tobacco, finally turning the corner on the impacts of tobacco. But alarming and concerning trends around vaping among youth, and they talk about important to look at prevention and reducing vaping among youth. Preventing non-smokers from vaping nicotine products, limiting online sales and advertising. Those are some of the key pieces to get towards national target of fewer than 5% of the population using tobacco. On cannabis, they talk about high rates in youth and young adults. They talk about the lower risk cannabis guidelines, which emphasizes if you do start using cannabis, do so later. Do I need to?
Sorry, I was just
I'll skip ahead, sorry. You're helping me make it closer.
trying to get it bigger, but it's
Brilliant. Okay, that's better. Thank you. They talk about limiting online advertising and sales of cannabis. You know, one interesting reflection in the report is around safety. We're seeing, especially young children, consume edibles at home and end up in the emergency department. Dr. Tom Bell talked a bit about this, and it was interesting to learn the sale of medical cannabis requires child-proof containers where you can't open, whereas recreational cannabis is just a regular container where a child can open. So edibles, therefore, could be accidentally consumed, especially if they look like candies to children, right? So there is data in the Ontario context of emergency department visits associated with that. So I think that's important, and certainly a reflection on more evidence-based management of cannabis use disorder, some of the more healthcare treatment-oriented pieces. On alcohol, they talk about the strategy needing to be to shift social norms, in particular educating for awareness about the carcinogenic, so cancer-causing effects that alcohol can cause. They talk about promoting Canada's new guidance on alcohol and health, bringing down rates, especially as they've been increasing among youth and women. They talk about strengthening policies to reduce risk of harms, including increases to alcohol pricing and taxation. They talk about monitoring the impact of increased sales of alcohol retail outlets or expansion of hours of sale, limiting marketing and sales, and access to effective treatments. You'll see as a pattern throughout. On the opioid front, you can see the list here of recommendations, actually the longest. This is something the board would be very familiar with, and a lot of the recommendations here are things that we've been talking about. But the CMOH talks about raising awareness of the risks of the toxic unregulated supply, addressing some of those upstream determinants, so things like housing, mental health, other services, the decriminalization of simple possession, as also, supported by the Ontario Chiefs of Police and has been done in other jurisdictions, including BC, Oregon, Portugal. The report talks about developing programs that reorient opioids from the criminal justice system to the health system so people get support and help they need, decreasing stigma, ensuring harm reduction needs are met, and along that, they talk about enhancing consumption and treatment site access and services. And in particular, as the board's advocated and written 2 letters to the Minister of Health in the last couple of years, the recognition that injection is a less common consumption pattern for opioids now than inhalation. And so the consumption treatment site that we have here, unfortunately, isn't meeting the majority of people using opioids as they inhale drugs. So they say ensuring that these services can quickly adapt to changing substance use patterns, such as inhaling opioid. Supporting friends and family of people affected through prevention, harm reduction, treatment services. So lots of good pieces. When we zoom out to some of the whole recommendations across substance use topics, they talk about coalitions and needing to provide community coalitions. Here in Peterborough, we have the Peterborough Drug Strategy, but when we look to other substances, there isn't that same kind of strong local network on probably as much tobacco, cannabis, and alcohol. They talk about provincial and federal and Indigenous governments and agencies to invest in upstream factors, investing in public health programs such as the Healthy Babies, Healthy Children, or here locally, as you learned about the NFP, the Nurse Family Partnership Program. Those are evidence-based programs that help to support nurturing development and environments, which actually decreases substance use later in life, which is really important. They also go on to talk about public health and social services working together, engaging these community coalitions, increasing local substance use prevention programs. And we'll have a presentation at the Way Board of Health, and there'll be an announcement coming into there with some of the work that we've been doing towards a new program to work on prevention of substance use harms among youth in particular. And we'll be really excited with some of the hard work that Hallie and team have been doing, and an exciting opportunity we'll be sharing next Board of Health meeting. The other pieces, they talk about partnering and engaging people with lived experience, working closely with populations affected on health equity, culturally safe care, addressing some of the systemic and structural stigma, racism, discrimination. And in the public health sector, they talk about increasing surveillance and some of the data, right? When I shared our local data, there are some gaps. We couldn't comment on cannabis, and there's some data missing for some of the substances. So we probably need better data to really know the exact impact. Evaluating policies and programs, determining whether the standards, as you'll know, the Ontario public health standards are being revised, but how they're changed. The CMOH references in the report needs to reflect some of the evidence that they've identified here. Continue to educate the public and working with regulators to enforce age restrictions on the sale of all substances. They have a lot for the healthcare system, which I won't go into significant detail on, but it relies on the roadmap to wellness, which is connecting mental health and addiction system, improving quality, access, services, and innovative solutions, effective and acceptable treatment, especially for vulnerable populations, looking at wait times and the challenges there for access to treatment, enhancing capacity of primary care, enhancing equitable access to screening, diagnosis, crisis response, etc., evidence-based treatment programs within correctional facilities. I certainly hear, as a physician, I've seen sometimes there's a big gap between when people leave prison and not having supports in place. I met one individual who was on opioid agonist treatment, so an alternate to opioids called Suboxone in prison. They were suddenly discharged. They were suddenly made to leave prison. I met this person on the street here in our community who was searching and trying to purchase fentanyl because they had significant withdrawal impacts, and there had been no plan for how they would get access to continued Suboxone, which is an opioid alternative, so they could continue to get support. So I think a lot of work within correctional facilities and the connection to community care that is highlighted well here. Enhancing access to equitable evidence-based treatments, pharmacotreatments, but also they talk about longer-term residential treatment, et cetera. Obviously exciting with the ongoing work here locally with the forecast CMOH addictions treatment center that'll hopefully be opening soon, that the provincial government has funded, and that kind of access and improvement, I think, important there as well. And ultimately, the report concludes, if we don't invest upstream, more Ontarians will die, preventable deaths, families will continue to suffer, province will continue to spend billions each year to cover the healthcare, social, legal policing costs of substance use harms. So hopefully that was helpful. I know the report was in your package, but this is one of those reports that I think will continue to be interesting and relevant as we try to path a way forward. Certainly when you look at these substances and the challenges our community faces, it seems sometimes, at least to me, even insurmountable, but there is good evidence in actually what we can be doing and what we can be doing more of. So I know there'll be lots for the province to reflect on, but I think even locally this, to the cover and title of the report, Balancing Act, it's a complicated subject matter, but I think there is probably a lot more that we could do, and hope this was helpful to reflections and spark some conversation.